So thank everybody for joining this afternoon, and welcome to the Health Innovation West Midlands Clinnovate West Midlands programme, which is a collaboration with Cognos and Health Innovation West Midlands. Bit of housekeeping. We will have the opportunity for questions and answers at the end, but if you want to add into the chat any questions you may have as we go along, there will be a number of questions at the end that will be put forward and answered by Kat and Martin, who I'll introduce in a second. But please feel free to input some questions into there. As you can see, it will be recorded as well, so we will be able to post this once it's finished. So it gives me great pleasure to pass you over to our first couple of speakers, which is Judith Stewart, and then we'll be followed by Kat and Martin, both from Cognos. So over to yourself, Judith. And
Thanks, Andy. And can I just say thank you to everybody for coming along this afternoon. Really appreciate your interest in our programme. It's really exciting, and I'm hoping that by the end of this afternoon's presentation, you'll understand a bit more and be keen to get joined in. Next slide, please. So I am Judith Stewart. I'm Director of Health Innovation West Midlands. I lead the work that we do with innovators, and that includes yourselves as clinical entrepreneurs and clinical innovators, people who are looking to come up with new ideas and ways of supporting change in our NHS and care partners. A little bit about ourselves. So Health Innovation West Midlands, we cover the whole of the West Midlands region. So currently that is the 6 ICBs, as you can see on the screen there, obviously shortly to become 3. Our role is very much about leading that innovation transformation piece. So we are working on numerous projects, and over 70 at the last count, with our various key stakeholders and partners across the region, looking at how we can support innovation across all elements of NHS and care. It's very much part of a wider piece of work with 15 health innovation networks. So we are one of 15, and we do collaborate nationally as well. Very much looking at how we can support our clinicians, support our systems, support our population to achieve better health outcomes for all. In terms of the way that we operate, as it says there, we are connected a network of networks. This is how we operate. So we will look at national programmes, we will look at local programmes, and each of us is very much embedded in our own system and doing different things. And that's why I'm absolutely delighted to bring this new programme, Clinnovate West Midlands, to yourselves this afternoon. For a long time, I've recognised that much of the innovation that we see when we're doing our work is coming from people who are already in the system. And why would it not? You guys know the problems that are more acute, the issues that you're overcoming on a day-by-day basis, and obviously spotting gaps where new approaches and innovation can really support better care options for our population. Cognos have been working in partnership with a couple of HINs for a wee while now, and we've taken it a wee while to get to this point to launch the programme, but I'm absolutely delighted that we are now at the point of launching Clinnovate West Midlands. All I would ask is that you make sure you ask all the questions you have and keep them coming in even after the end of today's event. And if you are interested in joining our programme, that you fill in the form. Details of all of that will come in later. Just one final thought from me. One of the things that I've discovered, having moved to the West Midlands about kind of just nearly 2 years ago, is the sheer amount of innovation and indeed support that there is for people working in health and care and in that innovation space. This programme will provide a vital extra element into that ecosystem, and we'd be very delighted to work with any of you on that. If there are other projects or areas of interest that you have, feel free to make separate contact with us outside of the programme, because we are always here to help. But I hope you have a really productive session today, that you get your questions answered, and look forward to welcoming you to the project. I'll hand it back to Andy. I have to say Andy has picked up this project. Andy Baldry is working with us here at Health Innovation West Midlands and is your key kind of contact in terms of moving forward. But thanks to Andy, Karen, Kat and Martin for coming along and supporting the webinar this afternoon as well. Have a great time. Thanks.
And thank you, Judith, for that intro. Perfect. So over to Kat and Martin.
Hi everyone, I'm just going to share my screen so hopefully you'll be able to see that. If I can have a thumbs up, Panda. Fabulous, brilliant. So hi everyone, lovely to meet you all. So oh, Amanda, so you've got a question? Nope, I'll carry on. Cool. So I am the business development manager for Cognis. I've been at Cognis for just over a year now, but previously started my career in mental health and then came over to health tech and worked in different organisations in health tech for about the last 15 years. So what is Cognis? So Cognis is a no-code ecosystem for digital health. So we empower health experts to create patient-facing digital health apps without any coding experience. So in order to start building on Cognis, you don't need to know your JSON from your Python. You don't need any technical experience. So the Cognis mission is to empower the world's best health experts to create the world's best digital health products. And we do this by supporting health providers to deliver scalable and personalised digital health. So I'm sure many of you will be familiar with this diagram. So the traditional development and kind of the many barriers. So what we often see is clinicians especially have great ideas that can, really change health outcomes for patients. But because of all of these different barriers, what we often see is they just fall off the mountain cliff. So traditionally it takes about 2 years to get an app to the App Store. High total cost of ownership once you've got there. So traditionally it takes about £334,000 to launch your first version of your app. And then when you've got that there, it's all the scalability, privacy, regulations and compliance. So what Cognis aims to do is kind of change that and kind of get ideas to market faster. So rapid time to market, so you can start building on Cognis in weeks and months rather than years and years. Low total cost of ownership, and then because we only work in healthcare, we look after things like the privacy, security and compliance. So what we aim to do is just get that innovation to market a lot faster. So before I hand over to Martin, I'll just kind of show you briefly the Cognis platform. So on the left-hand side, what you'll see is Cognis Creator. So that's where you go in and you build your app. So it's all component based, it's point and click. You go in, you turn things on, turn things off. Different really cool functionality in there as well, so things like gamification, win streaks, reward streaks, etc. But what I really love about this is you can really do that co-design with the user group. So if, for example, you've got a user group together and they said, I don't quite like the way that that's laid out, or I want that on kind of the colour changing or the wording changing, what you can actually do is go into Creator, make those changes, hit save changes, and then it's there live on your app. So you might also recognise the app on the right hand side. So that's a recreation of Headspace, the #1 mental health app. We call it Cogspace. We set our customer success team a challenge to go away and recreate Headspace using publicly available content, just to see kind of the art of the possible if it could be done on Cognis. It took our customer success team 11 hours to recreate Headspace on Cognis, and just for context, it took them 2 years and $10 million to get version 1 to market. So it kind of just shows you the functionality and the art of the possible. And on that note, I'll hand you over to Martin, who's going to give you an overview of the Clinnovate programme.
Thanks, Kat. So yeah, I'm Martin. I'm a senior customer success manager here at Cognis. What that means is I work with all of Cognis's customers here in the UK, both private and public sector. As Judith mentioned earlier, we are already running similar programs with other health innovation networks, and I lead the delivery of those programs. So the Clinnovate WM program is a structured program across 6 months that will enable successful participants to transform an idea into a fully functioning MVP of their digital health solution. So over the course of that 6-month program, participants will be onboarded to the program and trained on how to use the Cognis no-code platform, as Kat's just showed you. That will enable you to build your solution, and you'll also receive guidance on how to design your app through various workshops and resources, all provided by the Cognis team. So once participants begin building their app, they'll receive hands-on support from the Cognis team, myself included, throughout the duration of the program, and then they'll be able to test their app and also iterate their MVP based on that user feedback. So finally, they'll then receive support from both the Health Innovation West Midlands and Cognis teams as they look ahead to planning the next steps for their digital health solution. Back to you.
Well, thanks, Martin. And then I think what we're going to do now, and Andy can confirm, is we're just going to answer a few of kind of frequently asked questions, but please do feel free to put questions in the chat, and we can answer those as well at the end of the call.
Cool. So thanks for that, Kat and Martin, for the insights there into the Cognis program. So Kat, what kind of solutions are you looking for?
Yeah, absolutely. So this program is designed to support patient and consumer facing digital health solutions that generally drive direct outcomes for patients, and this can be across prevention, diagnosis, treatment and long-term management. So it's not intended really to support tools serving like the administrative side of digital health, such as like booking systems and EHRs, but kind of the main types of digital health solutions that are suitable for the challenge are things like digital therapeutics and interventions, health education and informational products, remote patient monitoring solutions, assessment and diagnostic tools, diagnosis and treatment support tools, things like mental health support products, including things like addiction treatment, and then decision support tools for clinicians. So for the program, ideally, we're looking for solutions that can be built into an MVP on the Cognis platform without any additional custom development.
Thank you, Kat. Martin, if someone has already built an early version of an app, can they apply?
Yeah, look, absolutely. So I think if someone's interested in the program, but they've already perhaps built a prototype or MVP, they can absolutely still apply. However, I think, successful applicants will only fully benefit from the program if they are then prepared to kind of rebuild their solution on the Cognis platform. And the reason for that is just because it allows them then to take full advantage of our compliance, scalability and support ecosystem. And that ensures a consistent framework for evaluation and adoption of their app in the future, especially when thinking of things such as DTAC.
Just another one. The solution I want to build is only for a small relative population size. Is this okay?
Yeah, absolutely. So we actively encourage solutions targeting small population sizes, such as things like specific communities or underserved groups for example, culturally diverse groups or those facing condition-specific inequalities. So yeah, absolutely, please do apply.
Lovely. Martin, how much time will participants need to commit to the program?
Yeah, that's a great question, Andy, and I think it's a difficult one to answer, just because ultimately it does depend on a number of different factors. And those can include the current maturity level of the idea, whether the app has already been, perhaps planned and designed, if content has already been created or not, and also the overall complexity and comprehensiveness of the solution. But in general, a reasonable estimate would probably be somewhere between 10 to 15 months, 50 hours per month, sorry. So over the course of 6 months, you're looking at kind of 60 to 90 hours in total.
Thank you, Martin. I know this will be a burning question, Kat. So who actually owns the IP?
Yeah, it's a great question. So it's a question that comes up a lot. So and Cognis are quite passionate about this as well. So all of the IP of the solutions that are developed on Cognis is 100% owned by the app creators. I quite often hear some horror stories of people who've gone down traditional development routes and then they've been charged for their own IP. So you guys are the one that's inputting it, inputting the content and all of that information. So it's 100% owned by you.
Thank you, Kat. Martin, can the apps that are on Cognis, can they integrate with external tools?
Yep, so the Cognis platform does support integrations with external data, content, sources and other systems as well, but integrations would most likely not be included within the scope of this program. So solutions that are less reliant on external integrations for their MVP are more likely to be selected. And that's simply just down to the lower technical risk of the solution, but also there being less reliance on the applicant's own technical skills as well. So what we would kind of generally recommend is to architect your solution so that the MVP can be delivered without any integrations. And then if integrations are needed for a future version of the solution, then those can be scoped out with the Cognis team in the future.
Thank you, Martin. Going forward, Kat, will participation guarantee that an NHS pilot after?
Yeah, so I'd love to say 100% absolutely, but having worked in the NHS and having sold to the NHS, you know, I'm sure you all understand the difficulties of that. So participation itself does not guarantee a pilot. However, what we do, why we work with the health innovation networks, is so they can provide guidance on evaluation and adoption pathways and help identify any potential NHS partners where appropriate. And then, Andy, I suppose back to you of kind of how the HIN supports innovators to get those pilots out there.
Yeah, thanks, Kat. Yeah, so you know, if you're a successful applicant and your app's been built, etc., as you go through this process, obviously we'll be in close contact. You're an innovator that's from start to finish. You're with us and supported all the way through. I mean, we can't, once to say, guarantee that that'll be a pilot, but what we do to support you as an innovator going forward would be to look to where we could potentially source. You may have connections within your current working environment that you might be able to tap into and use. So we could maybe support that and help build that. We'd also support building or to help source funding, etc. You know, grant writing, everything that an innovator would get support wise, you'll get exactly the same from the West Midlands Health Innovation Network.
Andy, we've
So,
had
Martin,
some questions. Oh, sorry.
So no, I've got
I was
one
going to
more
say
question.
one more question,
Martin's got
then
the
I will
last
come in.
question,
Sorry,
and then we'll come to the chat. It's okay. So, Martin, what happens to sorry, this is is UCAT, I think. Is what happens to the Cognos Access after 6 months program ends then?
Yeah, so our aim is essentially to make your solution sustainable, both for yourself and the health systems, so it can reach more patients and make an impact. You know, as Judith was saying earlier on, you know, sometimes the best advice is from you guys as clinicians. This program is ring-fenced only for clinicians. But one of the objectives of the programme is to help you secure the funding to support your Cognis app beyond the initial 6 months and to help you find commercialisation pathways such as Andy's just described. So then after the programme ends, what you can do is keep your app in a sandbox environment until you secure funding. You'll be able to access and download all your app data and content at any time. And what we tend to find as well is once you've got that MVP and it's been tested on a user pool, it's a lot easier to attract funding because you know it's not prototypes, it's not slides, you've got something that's actually tangible that funders can see. What we also do as an organisation is we actively promote your product via our Cognis marketplace, and that'll give you another potential path to commercialisation as well. And then if you want to continue developing your app, we also offer innovator-friendly pricing that scales to meet your needs. And then if your app is adopted by an NHS organisation or a health system, a charity, or launched independently, the adopting organisation then will need to pay for a Cognis subscription. And then if you wanted to sell or distribute your product directly to consumers, you'd need an active Cognis subscription also when that begins. But we kind of work with you along the way of the program as well and kind of outline that and work with you on to support any potential funding bids.
Lovely, thanks, Kat. Is there anything else you want to add, Martin, or are you happy with everything? We'll move on to the questions in the chat.
No, I think we've got a lot of questions in the chat,
Yeah?
so yeah,
Yeah,
let's move on to those. Yeah.
Would it be
Karen,
helpful if I read them and then you, Andy, can just say who will pick it up?
yeah, go for it.
Does that work?
Yeah,
Yeah,
Kat,
we can all
Martin
add.
will
Yeah, I was
pick it
going to
out
say.
anyway.
Okay, great.
for it.
So what is the license? So sorry, let me put the name. Hamid has asked, what is the licensing model and hence revenue implications on an app created on Cognis?
Yeah, I'll take that one. So basically, Hamid, what happens is it all depends on, we have a subscription model. It's an annual subscription. So if you wanted to go in and make any changes to your app, you're not seeing those kind of ongoing costs because it's a year subscription, and that all depends on kind of number of end users and number of apps that you have, and we kind of scale as you scale. So we've got those, you know, very early innovator rates up to, you know, successfully hopefully having 100,000 active end users on, and we'll work with you along the program to build on that.
Great, thank you. The next question is from Amanda, who has asked, can it offer a range of languages? Can the user build agents? And does it allow for a range of diverse images?
This is you, Martin, I suppose.
Yeah, I can take that one. So in terms of languages, so currently Cognis doesn't support any kind of automated translations, but you can absolutely kind of build your content into different languages if you need to. And then there are kind of mechanisms within the platform to present content in those different languages based on language selection questions from your users. In terms of building agents, at the moment we don't kind of support any AI agents, if that's kind of what you're sort of asking there. In terms of the diverse images, so yeah, Cognis supports various different content types. So yeah, absolutely, you can upload as many you know, images as you want into your Cognis app.
Thanks, Martin. Paul has asked, when an app is built on Cognis, and I think you may have already covered this. This is about intellectual property handled. Does the founder retain full IP rights? And the answer was yes.
100% yes, Paul.
Brilliant. And is the Cognis Cyber Essentials Plus accredited and DTAC compliant?
Yeah, I'll take this one. So absolutely. So we are obviously we work in healthcare. So we have all of those accreditations. We have also we understand that DTAC is a barrier to getting new pilots within the NHS. So what we've done is we've simplified that process for our innovators. So it was Martin actually built a DTAC app on Cognis, which is self-accreditation. I think you did that in about 3 days, didn't you, Martin? What he doesn't know about the products isn't worth knowing. But yeah, we've got that kind of DTAC app to support you to get that quicker innovation as well. What we aim to do is remove as many barriers as possible in order to get your innovation out there into the NHS.
Thank you. And Nathaniel has asked, is the app supposed to be used by clinicians for internal purposes, or would this be something we could offer patients to download and use?
Yeah, do you want me to take that one, Martin? Yeah, absolutely. So yeah, you can use it as we have apps for like clinician education and awareness, but absolutely we have apps as well for patients to be able to download and use. So things like you could put on there like health questionnaires, daily check-ins, journals, etc. All of that kind of functionality that you'd want to collect from the patient.
Thanks, Kat. Tanisha has asked, I have a number of images that would be required. Do you help produce these if they are part of the app?
I'll take that one. So yeah, as mentioned with an earlier question, so you can upload images into your Cognis app, and what we actually have as part of our help center is various kind of templates that are already kind of formatted to fit into Cognis. So you can use kind of design tools such as Canva as an example to help you kind of create those, and then just kind of it's a simple upload into your app. There's a media library which then enables you to kind of select those images and use them throughout your app wherever you need to.
Lovely, thank you, Martin. Hassan has asked, once the app is made, are the raw source files made available? Colleagues did something similar in my previous trust, but the no-code platform used for that app was no longer supported. So then IT had to recode it from scratch.
Martin,
Shall I take that one, Kat?
Yeah,
sure.
Anything technical, I hand over to Martin.
So, I mean, in terms of the raw source files, not as such, but what you can do is basically download a JSON file, which is going to have all of your kind of app structure and content in there as well. So that is something you can do, as Kat mentioned earlier.
Thank you. And Amanda has asked if we have, I think she means examples. Do you have examples that you could share?
Yeah, absolutely. So what we'll do when Karen kindly sends out the slides, I'll put some links onto some case studies and some videos on there as well, so you can have a look. My contact details will also be on there, so I'm more than happy to kind of take you through in more detail before you apply of the Cognis platform.
Thank you. A question. Sorry, the sun's in my eyes. A follow-on question regarding subscription costs. May I ask the annual cost of the App Builder, App Builder Pro and Enterprise Builder plans, or are these not fixed cost plans?
Yeah, absolutely, Hamid. So traditional subscription, we start kind of low for the number of, if we had, for example, 100 end users, annual subscription is £11,998,000, and then we kind of build on from there depending on number of end users and number of apps that you have as well. We are very transparent with pricing, but traditionally we're about 90% less of the cost of traditional software development.
Thank you. Somebody's asked what DTAC is, and then somebody has very kindly already answered. So the next question is from Hassan. Can it do API connection to other apps? Martin. Sounds technical.
So yeah, just as kind of mentioned earlier, for the purposes of the program, you wouldn't be able to set up any sort of API connections or integrations. But should you kind of look to kind of continue, with Cognis beyond the program, that's absolutely something our team can kind of explore and scope out for you.
And last question, yes, Amanda did mean examples, so that's great. So when we've got the recording and slides and things like that, what I'll do is I'll send them to everybody who has signed up for this session, and it'll come via probably MailChimp, just because it's easier for me to drop everything into there with case studies and all the things that you will need. Hassan has asked, can it do things like take pictures and analyze the picture, e.g. barcode scanning, or can it calculate quantity from a picture?
Take that one. So you can upload images. At the moment, there isn't any kind of image analysis functionality within Cognis. Obviously, kind of once you do get into that sort of functionality, you are potentially kind of moving towards medical device rather than kind of health and health applications. So yeah, at the moment you can upload images into a Cognis app, but there's no kind of image analysis or scanning functionality.
That is the last question in the chat. So if anyone else has questions, please do put your hands up and I can unmute you.
Thank you both so far for answering those. Amanda's got a question.
Right, let me do the thing.
Hi, Amanda.
Hang on.
This is when we test the technology, isn't it?
Right, Amanda, can you hear us? Can we hear you?
Can you hear me?
Yes. Yeah.
Yeah. It's probably me, but often in maternity we talk of exemplars, and they're not just examples, but they are, it's a case study where you would highlight and almost show as a great example of how it's been used and how its impact has been received, but also then from a we look at how we measure quality improvement, so we'd be interested in how that is captured. So for me, that exemplar is really important for us to sort of see how it's being used to end.
Yeah, absolutely.
So thank you.
No, that's a great question. We are in the process of just doing that at the moment with Cambridge NICU. So what I can also do, because it was actually an innovator that came on the Health Innovation East programme that developed an app and is rolling that out now in the trust and looking to do that nationally as well. And we're kind of just doing that evaluation piece at the moment. But sorry.
Yeah, that's the kind of thing that would be really great to know about.
Yeah. And I'm sure Hilary, one of our innovators, would be more than happy to kind of speak to you if you wanted to about kind of her experience of developing an app on Cognis and how she's kind of rolled that out. She was actually going to do a video today of kind of her experience, but she ran out of time to do that. But I'm sure she'd be more than happy to speak to you, Amanda, of how that's worked in maternity.
Yeah, that would be great. Many thanks, Kath.
No problem. If you just reach out to me, I can put you in contact. Thanks, Amanda. Any other questions?
I think.
Yes, one more. Arlene has asked, if the user uploads an image as a creator, can I download that image?
Sorry, where's that question, Karen?
Just in the chat at the end, Martin.
Oh, sorry, yeah. Yes, you can absolutely. Yep. So any kind of images that users would upload into the app, that is something that you can kind of see in our Insights portal, which is basically where you'd be able to kind of access and download and export all of the data that's related to your app.
That is all of the questions in the chat, and I can't see any hands.
Is it worth us just running through the like program kind of structure? And kind of, yeah.
We have time. So
yeah, so basically applications are open now from the 9th of January. They are live on the West Midlands HIN website. It's quite a simple application. We've even put you example answers as well to steer you. What we will do then is we will evaluate them. Every applicant will get feedback, and we are taking on 10 clinical innovators on this cohort for 6 months, and then after the 6 months we'll be running the programme again. But we are doing interviews on the 27th and the 29th of January, so if you can make sure you're available for that. And then we'll be notifying successful and unsuccessful applicants on the 2nd of February, and then the programme will commence on the 16th of February. Just while in terms of the interviews, the kind of structure is you will have 5 minutes to pitch your idea for your health app, and then we can answer different questions on there. Anything else to add, Martin or Andy?
No, captured it perfectly.
Thank you.
No, thank you. No, there's nothing to add from my side. It was just to say that we've just dropped in the chat the link to the website. If you haven't already applied and done an application, then please use the link there and have a look and then apply if you're interested and you feel that this is appropriate for you. It's a really exciting opportunity for innovators and yourselves to be able to do this and to be part of this program. So please do look at the application and put your name forward. It would be great. I just want to before we do have some time, so I just want to give one more opportunity if there's any other questions to put it in there. During this period of waiting, if there is any more questions, I would just like to thank our speakers, Judith, who's already been on, Kat and Martin for batting all the questions back. Fantastic. Thank you very much. Giving lots of information and insights, and hopefully we have covered every question possible. And I would like to thank Karen for navigating and setting up the webinar and asking the questions from the chat as well. And lastly, I just want to say thank you all for attending today and taking the time. We have the full house as in attendees that registered, so that's perfect and much appreciated. So thank you all very much for joining today. If there isn't any more questions, which there isn't any coming in on the chat there, we will wrap this up early and you have a little bit of time back for your day. So thank you all very much. Keep an eye out for your emails, and we will send the recording and all the relevant material through. So thank you very much, everybody. Have a lovely afternoon.
Thanks, everyone.
Thank you.
Thanks.
Thanks.